So what we've seen in the treatment of systemic mastocytosis is, we've gone from kind of broad cladribine-based regimens to now we have novel targeted tyrosine kinase inhibitors. And this started with midostaurin back in 2016, 2017 with FDA and EMA approval. And midostaurin is a broad-based TKI, kind of a dirty TKI, and that it has multiple targets. And now with Avapritinib, which is a selective tyrosine kinase inhibitor, we're seeing more potent reactions. And then newer agents, you're seeing also very potent effects, and especially in terms of the bone marrow with disappearance of mast cell aggregates and marked decreases in mast cell burden. There's other therapies that are being looked at. There were antibody-based therapies like anti-CD30, brentuximab vedotin, but that was a failure and didn't work. And so now we're wondering about other like anti-KIT antibody therapies, but those aren't in a clinical trial yet. So I think there's more to come. And, it's very analogous to chronic myelogenous leukemia with the imatinib and the first, second, third generation inhibitors. What we're seeing in systemic mastocytosis is broadly analogous with now more and more selective inhibitors with fewer side effects.